Hi, it's Patrick Hutzel from IntensiveCareHotline.com, where we instantly improve the lives for families of critically ill patients in intensive care so that you can make informed decisions, get peace of mind, real power, real control, and so that you can influence decision making fast, even if you're not a doctor or a nurse in intensive care. This is another episode of Your Questions Answered. And in today's episode, I want to answer a question from one of our readers, Ken. And Ken has his 75-year-old dad in ICU after pneumonia and urinary tract infection. So Ken is asking, my 75-year-old dad is in ICU with pneumonia and urinary tract infection, and now he's on dialysis. He's been weaned off sedation, but he's not waking up after induced coma. How long does it take? So I'll read out my client's Ken's question. So Ken writes, "Hi Patrick, I was trying to research how long it would take for my dad to come out of a medically induced coma, and I came across your website. I really appreciate the fact that you're providing valuable information for families in intensive care, worried, sick, over loved ones in ICU. So thank you very much. That's why I thought I'll become one of your clients, because it's such a valuable website and service that you offer." So Ken writes further, "In my case, my father is a 75-year-old male professional who contracted sepsis, a urinary tract infection, and pneumonia. We don't know which came first, but all three were present when my father presented to the hospital and the ICU. The doctors first asked my father for permission to sedate him and put him on a ventilator because of the pneumonia. He had difficulties breathing. His chest x-ray was really poorly, and we and my father thought that it might be the best option to get him intubated and sedated for a few days. So my father and my family agreed to authorize the ventilation and intubation for further treatment while he was also becoming more and more unconscious, so we had to take over anyway. He was under sedation for 6 or 7 days, during which time they put him on dialysis as well to help the kidneys recover from a kidney infection. He was taken off dialysis 2 or 3 days later, and his kidneys were deemed stable enough to remain off dialysis. That seemed like victory number one. Shortly after that, he seemed to be clear of the urinary tract infection, and his lungs were clear enough that doctors felt he could come off sedation and wean him off the ventilator. They began reducing the amount of sedatives about 4 or 5 days ago, and he was supposedly entirely free from all sedatives 3 days ago. However, he still hasn't woken up. From your videos, I take it that he was considered medium-term sedation, and both his age and the fact he had kidney involvement may add to the time it takes to wake him up. The neurologist reports that his brain activity is normal and doesn't show any signs of dysfunction, although he doesn't seem to be waking up still. Our family is massaging his feet, and his respirations dropped from 30 to 21 and then to 19 during the massage. We assume the foot massage was comforting him, although he remained unconscious. Our questions, probably not unlike most family of ICU patients, is how long before he begins the waking up process. We're trying to be patient, but how long is too long? What's normal under these circumstances? I suspect you won't be able to answer any of those questions with certainty, but you've undoubtedly seen more than any of the people asking the questions. Thank you very much for all you're doing to ease the minds of families in intensive care in crisis." From Ken. Well, thank you, Ken, for writing in, and thank you, Ken, for being a client. I really appreciate it. So, Ken, the situation that you're describing with your 75-year-old dad is a situation I've seen hundreds of times in ICU. So, as a rule of thumb, the older patients are, the longer it takes for them to come out of the induced coma and wake up. Now, that's not to say that younger patients don't take their time either. It really depends, but generally speaking, as a rule of thumb, my experience has shown that the older someone is, the longer it takes for them to come out of an induced coma. The added on complexity in your dad's situation is the kidney failure or kidney sort of impairment. That certainly doesn't help with waking up, because it takes longer for the body to excrete the sedatives and the opiates. Because in your email, you're only referring to the sedatives. Now, when somebody is in an induced coma, they get sedatives such as propofol or midazolam, also known as Versed. And they also get morphine or fentanyl on top of that, which is basically an opiate. And both propofol, midazolam, or fentanyl and morphine basically sedate the patient so heavily that it takes time or it can take time for them to wake up. And again, with the complication, with the added-on complication of a kidney impairment, it takes even longer, because it takes longer for the body to get rid of the sedatives and the opiates. With the urinary tract infection that you shared, that could have also led to to the kidney impairment, because you don't say in your email that the kidney impairment was part of the hospital admission. It sounds to me like it came later. Also, if your dad has developed a sepsis often does lead to kidney impairment, just simply because the sepsis drops blood pressure significantly. And if blood pressure drops significantly, your dad's kidneys might not have been perfused enough, and therefore kidney failure might have followed on from that. There's also a very good chance your dad with the sepsis and the pneumonia would have been on inotropes or vasopressors for low blood pressure, which is considered life support. So your father has been on multiple forms of life support, which are the mechanical ventilation and the inotropes or the vasopressors. So with that being said, they would have treated the sepsis with antibiotics. They would have treated the pneumonia with antibiotics if it was a bacterial infection. Might have been a viral infection, but you didn't mention that. And now you're saying that your dad's infection seems to get better, which is a good sign, of course. And they might have stopped the antibiotics or at least reduced them. So again, probably best if you ask those questions to the intensive care team. Again, the biggest challenge for families in intensive care is always that they don't know what they don't know, and they don't know what questions they need to ask. So also with the dialysis, there is a very good chance again that the sepsis with the combination of the dialysis would have dropped blood pressure even further, because usually when blood gets extracted from the body through the dialysis, it brings blood pressure down, again making it way more likely that your father would have ended up on inotropes or vasopressors throughout the dialysis in the combination with the sepsis. Again, it brings blood pressure down. So now you're saying that the lungs are clear enough so that the doctors feel he could come off sedation. So that's the first step. They began reducing the amount of sedative about 4 or 5 days ago. He was supposedly entirely free from all sedatives 3 days ago. However, he still hasn't woken up. So, Ken, it's very important to find out what sedatives and opiates your father has been on. So, for example, propofol is a very common sedative in ICU, and it's short-acting. What that means is, you get started, somebody gets propofol, they can be put to sleep very quickly within minutes, and they can also wake up within minutes, right? The longer somebody has propofol, the less likely it is that they wake up quickly. But they could wake up quickly even if they had propofol for a few days. What's often an adding factor for people not waking up is the opiates that I mentioned, such as propofol, such as morphine or fentanyl. Those are heavy opiates, very powerful. So if somebody gets morphine or fentanyl in high-ish doses, it makes them sleepy as well. And again, with the added on complexity of kidney failure, the morphine and the fentanyl might make your dad, or might have made your dad so sleepy that he's not waking up quickly. Also, if your dad hasn't had propofol for the induced coma, but he's had midazolam, or also known as Versed, this is a long-acting sedative, which means it takes much longer for the sedative to get out of the body system. So therefore, you want to find out, number one, which sedatives your dad has been on. Also, a sedative like midazolam is a benzodiazepine, and it is an addictive substance. So therefore, if your dad has been on high doses of midazolam, as well as morphine and fentanyl, because morphine and fentanyl are addictive substances too, there could be an element of withdrawal going on, which is why your dad needs to be weaned off those sedatives and opiates slowly. They shouldn't just be switched off, because again, your dad could go through some withdrawal there. So therefore, your next step really is to find out what sedatives and opiates he's been on, and then get back to me. On the other hand, your dad has just been through a severe critical illness with a pneumonia, with a urinary tract infection, with the sepsis and the dialysis, which means, on paper, your dad should wake up quickly. But the reality is he's just had a significant critical illness, critical event in his life. He's probably as close to death as he's ever been. So don't expect your dad to go back to normal quickly. It can take time. His body might just say, look, you've switched off sedatives, you've switched off opiates, but I'm not ready to wake up, right? He needs the time to recover. His body needs time to recover from the pneumonia, from the ventilation, from the induced coma, from the kidney failure. So give your dad the time he needs. Recovery in intensive care is a process, not an event. It's not as simple as, you're switching off sedation, you're switching off opiates, and your dad is going to wake up like switching on a light. It's like switching on a light with a dimmer, slowly, right? Does it come with risks? Of course it comes with risks. You want your dad to wake up as quickly as possible, and I'm with you. But the reality is that's not happening in many situations, which is why it's such a big point of contention for families in intensive care. They would love their loved ones to wake up quickly, but again, it's a process and not an event. The biggest risk for your dad not waking up quickly is simply that he can't come off the ventilator, because he needs to be fully alert to come off the ventilator, right? He needs to be able to breathe by himself. He needs to be able to obey commands. And I'm glad to see that you are massaging his feet, you're trying to stimulate him. That's fantastic. And, you should also ask the nurses and the physical therapists and the physiotherapists to keep doing the stimulation, to give him very good nursing care with washers, mouth care, regular pressure area care, so he's not getting any pressure sores, so his skin doesn't break down, and all of that. I'm also glad that you got a neurologist involved, because if he's not waking up, he definitely will need a CT scan of the brain to rule out a neurological event, to rule out a stroke, and things like that. So you are definitely on the right track. But my advice really is that you will need to be patient to carry on, and to be very mindful of your dad. If he's not waking up, he might need a tracheostomy, which could lead to long-term ventilation. And you certainly want to avoid that. Sort of the cutoff for removing a breathing tube is sort of 10 to 14 days. And if somebody's not waking up and they still need mechanical ventilation with a breathing tube, they again might end up on with a tracheostomy that could lead to long-term ventilation. So you don't want that. And you certainly need to keep stimulating your dad, and the team there needs to keep stimulating your dad to get him to wake up. Other things you can do is definitely get him out of bed, sit him in a chair, even though he's ventilated. That will stimulate him. It helps to strengthen his breathing muscles, because he will need to strengthen his breathing muscles to be able to be weaned off the ventilator. So those are all very important aspects of the waking up process and the recovery. But again, I can't stress enough that waking up after an induced coma is not a straightforward event often, especially for older patients. Other things you need to look at is, the chest x-rays. They need to do repeat chest x-rays to make sure that your dad's pneumonia will stay clear so that he is ready for extubation, which is the removal of the breathing tube. Please also keep looking for blood results such as hemoglobin levels, which are the red blood cells. Keep looking for white cell count, because the white cell count will tell you whether the infection has really gone. A normal white cell count is between 4 and 11. Anything above 11 indicates that he might still have an infection. Obviously, ask for your dad's temperature. Is he febrile? Does he have a temperature? That would also be an indication if he still has an infection / sepsis. Other things you should be looking for are things like electrolyte levels, such as magnesium, potassium. They can often be deranged, especially during or after dialysis, and those potassium and magnesium levels are quite important also. Furthermore, if they stop dialysis, keep looking for urine output. Is your dad now producing urine? Are his kidneys working? Is he off the inotropes that I mentioned earlier? Because if he's off the inotropes, the only form of life support your dad is on then is the mechanical ventilation if the dialysis stays off. Because if that's all normal, then the focus can be 100% on getting your dad to wake up. Other things that are important when your dad will be weaned off the ventilator. Again, I highlighted the importance of the chest x-ray, but also other things that are important. How often does he need suctioning through the breathing tube? Does he have a good strong cough? What are the arterial blood gases showing? Are they physiological? Are they adequate for the level of ventilation he's getting? Can he breathe by himself, i.e. before he comes off the ventilator, he will need to breathe spontaneously with minimal support, and the arterial blood gases need to be within physiological levels, and your dad need to be able to obey commands such as poking out his tongue, move his feet on command, squeeze your fingers, and nod or shake his head to simple yes and no questions. So other than that, I have created extra ebooks for when somebody is not waking up after an induced coma. For example, I wrote one ebook with videos and audio recordings, the 10 most frequently asked questions when somebody is not waking up after an induced coma, and also another ebook that comes with videos and audio recordings, the 5 biggest mistakes you are making if your loved one is not waking up after an induced coma, and I put some links below this video in the written version of this video blog. And another article and video that you can read or watch is how to wean a critically ill patient off the ventilator and the breathing tube. That is also very helpful in your situation. Well, thank you for watching. I really hope that helps Ken, and I hope that helps other families that are in a similar situation. So, how can you become the best advocate for your critically ill loved one? How can you make informed decisions, get peace of mind, control, power, and influence quickly whilst your loved one is critically ill in intensive care? You will get to that all-important feeling of making informed decisions, get peace of mind, control, power, and influence quickly when you download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you will learn quickly how to make informed decisions, get peace of mind, control, power, and influence whilst your loved one is critically ill in intensive care. Your free Instant Impact Report gives you in-depth insight that you must know whilst your loved one is critically ill or is even dying in intensive care. Sign up and download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you will learn how to speak the secret intensive care language so that the doctors and the nurses know straight away that you are an insider and that you know and understand what's really happening in intensive care. In your free report, you will also discover how to ask the doctors and the nurses the right questions. Discover the many competing interests in intensive care and how your critically ill loved one's treatment may depend on those competing interests. How to eliminate fear, frustration, stress, struggle, and vulnerability even if your loved one is dying. You will get 5 mind-blowing tips and strategies helping you to get on the right path to making informed decisions, get peace of mind, control, power, and influence in your situation. You will get real-world examples that you can easily adapt to your and your critically ill loved one's situation. How to stop being intimidated by the intensive care team and how you will be seen as equals. You will get crucial behind-the-scenes insight so that you know and understand what's really happening in intensive care and how you need to manage doctors and nurses in intensive care, and it's not what you think. Thank you for tuning into this week's Your Questions Answered episode, and I'll see you again next week in another update. Make sure you also have a look at our blog section for more tips and strategies, or simply send me an email to support@intensivecarehotline.com with your questions. Also, have a look at our membership site, intensivecaresupport.org, for families of critically ill patients in intensive care. You can also call me, find phone numbers on the top of the website. Also, have a look at our ebook section, and you can also get one-on-one consulting and advocacy with me over the phone, via Skype and via email, by clicking on the relevant tabs on the top of the website or by just giving me a call. This is Patrick Hutzel from intensivecarehotline.com, and I'll talk to you in a few days.